Hi, this is Dr. Dean. A common question always asked to me whenever a patient comes to our clinic for memory problem, for attention or focusing problem, why do we screen for anxiety and depression? And the answer is anxiety and depression can affect our memory. In our language, sometimes we use the word called pseudo-dementia. So there are certain ways by which anxiety and depression can affect our memory. Like the common causes which I have seen in my practice is whenever they are suffering from anxiety and depression, their sleep is affected. They are not getting good solid sleep, which can affect our memory. And the most common memories which are affected is episodic memory and working memory. There are other types of memory which are also affected by depression and anxiety. The other reason why this affects our memory is it basically causes imbalance of different neurotransmitters in our brain. And these neurotransmitters are also responsible for our sleep and for our memory. The other reason is the person who is suffering from anxiety and depression, they are not able to stay focused. They are easily distractible. They are not able to perform multitasking. They cannot stay focused, and usually the focus is very, very limited in these patients, and this also affects their memory. Other reason seen in some certain studies is those patients who are suffering from anxiety and anxiety, depression, and memory problem, their cortisol level is usually very high. Cortisol level is a hormone in our body which is secreted whenever we are going through under a stressful situation. And in certain studies, it has been seen that cortisol sometimes affect or impair the function of a part of the brain we call is hippocampus. So hippocampus is responsible for our memory. So there are certain ways by which anxiety and depression can affect our memory. So I always recommend anybody who comes for any kind of problem with the memory, brain fog, or he's not able to pay attention, he's easily distractible. Always they need an evaluation for anxiety and depression. And the reason is because the management for anxiety and depression is different. And the reason is whenever we manage or we treat anxiety and depression, their all symptoms gets better. So it is very, very important to make a correct diagnosis. So I always say whenever you have any memory problem, brain fog, always screen for anxiety and depression. Please feel free to ask any question. Thanks. Have a good day.